So good afternoon, everyone. I'm hearing the conference is going really well. Thank you, Cher, for putting the conference together, making it available to the community, and also allowing our participation in it. We'll have the presentation about the Medi-Cal Peer Support Specialist Certification, and hopefully we've answered your questions. No? Okay. All right. So the California Mental Health Services Authority, CalMHSA is how we pronounce it for short. We are a joint powers authority for the county behavioral health plan. The California Mental Health Services Authority, we develop and implement local and regional and statewide mental health services and programs on behalf of our members, which are the county behavioral health plans. So of course, nothing is possible without a group of people doing all of the work. And so we want to highlight our program specialists. We have several individuals who are hard at work, not only building out the program from the bottom up, but also processing all of your applications. So we have Will, we have Joanna, Milan, Giselle, and Ashley, who are there providing customer service behind the scenes, processing your applications, doing a lot of things. So we're very grateful for all of their time and effort. Additionally, we have other staff. Tatiana's here with us today. She's our administrative assistant and supports the process. We have an epidemiologist, a program manager, business analyst, as you can imagine, lots of contracts, information technology, right, for the website, for the application, and I am the program director overseeing the implementation of this program. Tatiana, is there a black bar in the way at the bottom of the screen, or we're fine?
I see more of a bar at the top, not at the bottom.
Yeah, okay, but you could see the full slide.
If you zoom out just a little bit, I'll be able to see the bottom part. That's good. Thank you.
All right. So how I'd like to start the presentation is to provide an overview. I mean, many of you guys know better than I do how we got here with Senate Bill 803. I know there were several bills that didn't make it through the legal process or the legislation process until Senate Bill made it through, I believe, in 2019 or maybe 2020. So Senate Bill 803 is the lawmaking bill for peer services, and this makes it, this allowed for Medi-Cal to be billed by Medi-Cal Peer Support Specialist certified in California. It's an optional benefit for county behavioral health plans. The Department of Healthcare Service, DHCS, they oversee the Medi-Cal programs and the peer benefit in California. So the Department of Healthcare Service is the state that oversees these Medi-Cal programs, and they set the certification standards for peer support specialists. They set the rates for reimbursement of those services under Medi-Cal, and they update all of the background, all of the contracts, all of the waivers necessary to make a certified peer support specialist a new provider type in our Medi-Cal programs. Then in California, the Department of Healthcare Service delegates responsibilities for the specialty mental health service and the substance use disorder services to county behavioral health plans. Counties enter into contract with Department of Healthcare Service, and in this particular scenario here, the counties are agreeing to opt into and develop a peer certification program. Again, they contract the Department of Healthcare Service, they get their system ready, their electronic health record, their billing systems ready, and then they will eventually, the county systems will eventually enter into an employer relationship with the certified peer specialist. The California Mental Health Services Authority, us, we are the certifying entity. So we were selected by the county behavioral health plans to represent them in the development of a statewide or standardized peer certification program and the certifying entity. we'll talk a little bit more detail about what the certifying entity does, some of those things there. But we have a little bit of information here. So we certify individuals that they've met the requirements for certification. We approve training providers. We do all of the board administration functions. Again, we act like the Board of Medicine or like the Board of Behavioral Sciences. So all of that stuff that in the background that needs to happen, including investigations of complaints against a person who has a certification as a peer specialist in California. And then, of course, there are individuals who apply to become certified Medi-Cal Peer Support Specialists. And then they together collectively become a certified workforce that can go across, the different counties. So that's an important part. I know, obviously, that there have been peer workers or peer supporters in the behavioral health system for many, many years. This Medi-Cal Peer Support Specialist certification is an additional pathway for peer workers. So I do want to at least acknowledge that. All right, so in California, we have one certification for Medi-Cal Peer Support Specialist. Certifications are for persons working with individuals in mental health and substance use disorder programs. And a peer self-identifies as a person having a personal lived experience or as a parent caregiver, a family member of a person with mental health and or substance use disorder conditions. All right, so this very important slide, again, in California, we have one certification, and that is the Medi-Cal Peer Support Specialist certification. And then there are 4 areas of specialization. The areas of specialization are intended to be additional training in an area of expertise for individuals interested in working with these more with these populations. So we have the parent caregiver, family member, peer specialization. We have a specialization for persons working with persons who are unhoused. The other specialization working with persons who are involved in the justice system, and then persons who are in crisis care. The Medi-Cal Peer Support Specialist certification that we'll talk about the different pathways in a little bit, but the information here is Medi-Cal Peer Support Specialist certification requires a state exam, which we'll talk about. The areas of specialization do not require the exam. However, the areas of specialization are intended to build on the knowledge, skills, and ability of the certified peer specialist in these areas of specialization. All right. So as the certifying entity, the California Mental Health Services Authority is responsible for the certification, examination, and the enforcement of professional standards for Medi-Cal Peer Support Specialists in California. As I noted earlier, we approve the training entities and we investigate any complaints and take disciplinary actions. One of the benefits that we have, so we're the 49th state to have peer certification as part of the Medicaid or Medi-Cal program. And so part of that is we were able to do a landscape of the different states and see how we could do things differently, kind of taking those lessons learned in other states and applying them here in California. So here in California, we have an opportunity because we have standardized the peer certification process. There's one website that you can go to for information about certification, and it's all kind of a one-stop shop. It's all inclusive. As I noted earlier, the certification standards are set by the Department of Healthcare Service. So we built a program based on those rules or those information or the guidance from the state. From the beginning, we have a stakeholder advisory council members that participate in this council group or committee, and they have been instrumental in the development of the program itself, as well as they continue to give us input on policy development and keep the peer voice really at the forefront of this program. So we're very fortunate to have a group of individuals who are committed to supporting this process. We, in terms of the peer voice, we also have subject matter experts that helped us with the development of the certification exam. Subject matter experts that helped us identify the core competency areas for the areas of specialization. And then we, of course, also, CalMHSA also employs peer workers. All right. We have a lot of responsibilities as a certifying entity. So we issue the certifications, right? A person applies. We make sure that we are applying the standards across all applications in a cohesive manner, that people who are applying are satisfying the requirements. We, like I said, developed the exam that is currently available at the statewide level, and we administer the exam on with a third party called Pearson View. We already talked about those areas of specialization, but as a certifying entity, our responsibility was to make sure that we identify the core competency areas for the 4 areas of specialization. Again, thinking about lessons learned in other states, we have an opportunity here for data collection. Because there is one certifying entity currently in California, we're able to collect and maintain records on the applicants or candidates who are applying for certification, those people who are certified, people who are receiving training, people who are receiving training as supervisors. So we have a lot of that information. And as a requirement by the state, we submit data to the state on a number of these things, as I just noted. There is a public-facing and searchable certification registry where you can go and see if an individual's certification is up to date. And then we do all of the administrative functions. We have quality assurance. We're going to do outcomes and evaluations of the program. And we, of course, do investigations as necessary. All right, but you're probably more interested in like, what are the certification requirements? All right, so all persons seeking certification must meet these requirements, right? They're all listed here. There are 9 that everybody must meet. And we'll talk a little bit more about number 8 and the different pathways and how there could be a distinction between whether a person identifies and wants to apply under the grandparenting pathway or whether they apply under the initial pathway. And I'll talk a little bit about those pathways. So you would submit an application through the website. Individuals must be 18 years of age or older, have a high school diploma or equivalent degree, identify as a person with lived experience and is willing to help other individuals in their recovery, have, of course, a strong dedication to recovery, agree in writing to the Code of Ethics for Medi-Cal Peer Support Specialists in California, meet the training requirement, and then successfully pass the exam. So we'll go a little bit more detail into this. I don't expect that you can read the items on the left-hand side, but they're the exact same ones that we just looked at. So these over here on the left-hand side are the requirements that all persons must meet. But let's say that you are interested in the grandparenting process. The grandparenting process acknowledges that people, again, have been working in a peer role for many, many years. And it recognizing that it allows an opportunity for an individual to demonstrate and use their lived experience, either paid or unpaid, in terms of working with others to satisfy the requirements toward certification. So under the grandparenting pathway, a person must be 18 years or older, high school diploma, self-identify as a peer, be willing to share their story of recovery, to help others, their dedication to recovery, agree to the Code of Ethics, pass the exam, but also they must meet one of the following requirements. So this is where your work as a peer worker comes into play under the grandparenting process. So you would have one of 2 options. You either have 1 year paid or unpaid in work experience and have accumulated a minimum of 1,550 hours of work experience in a peer role. Or maybe you don't meet that requirement. Maybe a better option is number 2 for you. Option number 2, which is a minimum, so the same amount of hours, 1,550 hours, but you would accumulate these over the last 3 years, with 500 of those hours completed within the last 12 months. So working as a peer in a peer role. All right, so let's say you have one of those, you're like, yes, I can identify either option 1 or 2, that's me. Then you would say, and here's the additional requirements under the grandparenting process. So you would have been employed in a peer role on January 1st, 2022. And at the time that you're applying for the parenting certification under the parenting pathway, you would need to demonstrate having completed 20 hours of continuing education, and 6 of those hours would be in law and ethics. These continuing education units or hours under the grandparenting pathway do require that they be in the last 2 years. You are also would want to demonstrate that you've completed a peer training. And of course, peer training is training that's focused on concepts of peer recovery and resiliency. And that training could have been 1 year ago, or could have been 5 years ago, or longer. So there's no time frame on that one, like the continuing education units or hours. Let's say that you took a peer training a year ago, you could use those same peer training hours to satisfy the requirement for the 20 hours of continuing education. And then you would also need 3 letters of recommendation, 1 from a supervisor, 1 from a colleague professional, and then 1 from yourself. That's a lot, but that's the rule. All right. Super easy. This one's easier. Same requirements, right? On the left-hand side, all the people must meet all those requirements. But that training requirement that's different here is an individual who's seeking certification under the initial certification pathway. You'll need to show evidence of having completed an 80-hour training for Medi-Cal Peer Support Specialist from a CalMHSA approved training entity. All of these training entities are listed on our on the certification website. That one's easier in many ways. All right. Well, I updated these slides. Give me one second. What happens when you update slides? One. Sorry about that. Sorry about that. All right. So you see it okay, or do you see the notes? Tatiana, is the PowerPoint okay?
Yes, it's okay. And no, we can't see your notes.
Okay. All right, so to this one. So we now want to look at the certification exam. So information about that. I don't expect that you can read all of the information on this slide. This is actually a snapshot from our certification website. And that information is the exam, certification exam is a statewide exam that's been approved by the state. So it's approved by the Department of Healthcare Service. And it's 120 items, multiple choice. And it takes approximately 2.5 hours to take. The areas of focus are spelled out. There are, let me see, 1, 2, 3, 4, 5, 8 areas of focus that are covered on the exam. And we also have a prep guide available on our website. Let's see, important things about the examination. So we do offer reasonable accommodations for the exam. We, of course, must get the request in advance of you sitting or scheduling your exam. And obviously the reason for that is that we need to make sure your accommodation is in place before we can, before you go to your exam, so it can be ready and prepared for you. The exam, as I mentioned earlier, is administered by a third party, which is Pearson VUE. We offer in-person testing throughout California, as well as online testing. Really important, since I have everyone's attention, maybe, is the rescheduling and cancellation of the scheduled exam. That's really, really important. When you schedule an exam, you're expected to show up to your appointment. If you don't show up for your appointment, you're considered a no-show. Persons who are considered no-show forfeit the fee, right? So you paid for that time slot and you didn't show up, so you forfeit the fee for that. So really important when you do schedule your exam to pay attention to the rescheduling and cancellation policy. Obviously, it's here on the screen. It's also available on our website. Yeah.
I'm so sorry to interrupt, but the slide right now is for the initial certification process. Do you mind putting up the slide for HMRO?
I did. Okay. What happens when I switch? You don't see something that says certification exam?
No, right now we see certification, initial certification process.
You don't see that slide? Change the slide?
No, still the same slide.
Worse. How about now?
We see certification exam.
What about now?
Certification exam, 120 item multiple choice. Yes.
All right, so sorry about that. So this is a slide I said I didn't expect that you could read. This is available on our website, 120 multiple choice items in the 8 areas of focus. I was talking about the reasonable accommodations. That was this slide. The rescheduling and cancellation components are very important, that you adhere to those rescheduling cancellation to avoid forfeiting your fee for your exam. And we'll talk about what the fee is. So this is sort of one way that we kind of explain the certification and approval process. So applications are approved for a 12-month period of time. A candidate is expected to have completed certification within that 12-month approval period. Candidates, we talked about this, a really important one because we get a lot of questions about this. So candidates do forfeit the exam and will need to reapply if they miss their exam or don't complete in the last, within the 12-month approval period. And the exam fee covers the cost of one attempt at the certification exam, and candidates may attempt the exam a total of 3 times during that 12-month period process. So all of the things that I described, I tried to do it in a 1, 2, 3, 4, 5 steps, maybe there's 7, but you would apply on the certification website, you would choose your certification pathway. We talked about either the grandparenting pathway or the initial pathway. CalMHSA will review the application. So when we do that, we'll either approve them, ask for revision, or deny an application because it doesn't meet the requirements. In terms of revision, we're using your email to communicate with you back and forth. So if you see your application is status is in revision, please check your email. You'll probably have some information there in terms of what's missing or what other information we might need from you to finish reviewing your application. The fourth step would be, we'll let you know once your application is approved. We'll let you know of your eligibility to schedule the exam, and we'll give you a unique ID number. You'll get that about 7 to 14 days after your application has been approved. And then you can schedule your exam. You'll use that unique ID number, and then you'll schedule your exam either in person or online, however you wish to do that. And then when you pass your exam, we'll issue your certification document directly to you. If you don't pass the exam, you will also be notified within the next 7 to 14 days following your exam date, how you can retake the exam, which would include paying a fee for retaking the exam. All right. So once you have been certified, the renewal is a biennial renewal, which means every 2 years. And what that means is that a person who has received certification and wants to renew their certification is required to demonstrate 20 hours of continuing education, again, inclusive of those 6 hours of law and ethics. And of course, those 20 hours would have been completed in the last 2 years since you received your certification. And then you would agree to the most recent code of ethics. Supervision of peer workers. So the Department of Healthcare Service sets the standards for the supervision of peer workers. They have indicated that a person who is interested in or acting in a supervisor role of a certified peer support specialist, that they would complete a training within 60 days of taking on that supervisory role. The training for supervision of peer workers is available and free on the certification website. It's about 1 hour in length. It's self-paced, and it's based on SAMHSA's best practice standards. And so that's available to everybody and anybody who's interested. We do have currently scholarships available for the application and exam and training, really under the initial pathway. So scholarships are made available through funding by the Department of Healthcare Service. They're time limited. They're scholarships under the grandparenting pathway, which would cover the cost of your certification application, as well as your certification exam at one-time take. And then the scholarship under the initial pathway would cover the cost of the certification application, the certification exam, but also would cover the cost of the training by a CalMHSA approved training provider. So those 80 hours that we talked about earlier. Our role and CalMHSA's role in terms of the scholarships is, of course, we're administering and distributing these scholarships. We, of course, are reviewing applications to ensure everyone meets the requirement for certification. And then, and it just says you would apply on the website for the scholarship. So again, there are scholarships currently available. There are less under the initial pathway than there are under the grandparenting pathway. So if you are interested, please do go on the website, apply your application plus scholarship application. All right. So we have our website is Tatiana, you might want to type this in the chat, capeercertification.org. So this is obviously a snapshot of what it looked like yesterday. We modified it a little bit, but it has information here. This is, again, a one-stop shop for you where you can find information on certification. There's different tabs. I'm not sure if you could see that, but we have a certification. So it's all information you need to know, everything I've just discussed here today. There's information on training providers, right? So for the 80-hour core competency training, as well as the areas of specialization as they become available. We also have information about the exam. There's information on that screenshot that you saw earlier, like what's on the exam, what is the prep guide, what does it have, the cancellation information, reasonable accommodations. So all of that is located under that tab. We also have a resource library that has a lot of more detailed information with some of the criteria or just additional information. And then we have a section for Spanish. So it's the landing page that has information that I'm sharing with you in Spanish. All right. So here is, at a glance, the certification fee. So applications for certification are $100. The certification exam costs not $150. The certification or the application to retake the exam, the certification exam is also $150. And then when you renew your application or your certification in 2 years, the cost is $80. One of the questions that we often get are, how much is the training for the 80-hour under the initial pathway? So training fees are not set by the California Mental Health Services Authority. They're set by the approved training providers. So those training providers identify, how much that training costs, and information is available on our website. You would register directly with them, so you can ask them directly any questions that you might have about their training. Of course, we have a whole list of them. We have 22 of them available on our website. And there's some information there in terms of like what kind of training modality, like is it in person, is it a hybrid, is it a mixed model? So you'll get some of that information on the website. And then for some individuals, you guys might be interested in becoming training providers yourselves. And so you might be an agency that has been training people for a long time and are interested in becoming a CalMHSA approved training provider, either for the area of core competency, which is that 80-hour for certification, or perhaps training in an area of specialization. So there is an application fee of $300 for those training providers that want to be a trainer under the areas of core competency or the area of specialization. We will open up the process for applications for continuing education providers. That's not currently open, but it will be. And then the renewal fee for a training provider who has received approval before. All right, and then sometimes we get questions about data, like what does it look like? What does California look like right now in terms of information? So here we have, this is from approximately middle of April. So the data changes. You can imagine we receive applications every day. We process applications every day. And every week we have a new number of certified Medi-Cal peer support specialists because we receive results from our vendor every week. But the breakdown of the demographics for the applicants. So these are of all the applications that we had on file. This is what it looks like. And you can see that the majority of individuals are employed full-time. See that at 73%. And then followed by 15% part-time employment. We also see age groups, right? We see that the largest group of applicants is between the ages of 26 and 60 years old. And then followed, I guess, close matchup, that is 9% for the other age groups. The majority of the applicants have noted that they speak English at 93%, and then next would be Spanish, 5%. And this is the demographic breakdown of, again, those applicants. The gender, as noted by the applicants on their application, the highest number are females that are applying for the certification. And then we have the race ethnicity breakdown on the right-hand side. we see that 36% are Hispanic or Latino, followed by white or Caucasian at 31%. So that's, and then this one here. So you might be wondering, like, well, where are all these applications? You know, applicants, where are they coming from? These are the different areas where we have seen or the person has identified where they live. So this is the California map, of course, you know that. And then the breakdown is of every county. So every county has obviously a different number of applicants coming through for certification. In my line of work, we look at it sometimes regionally. So that first graph is showing us by region, right? So we're seeing the blue bars are under the initial pathway, and the orange or darker or kind of reddish bars are under the grandparenting pathway. So you can see the distribution of those applications based on pathways, again, initial or grandparenting pathway. And then in my line of work, we also often will look at counties by their size. And so there's the distribution of applications for initial and grandparenting based on the size of the county. All right. So these are the ways that you can communicate with us. Visit our website at capeercertification.org. Email us at peercertification@calmesa.org, or call us. And there's our phone number. We're available Monday through Friday, 8 to 5, excluding holidays. There's a number of resources. All of these resources are really from our certification website. I just sort of put the links here. I think the presentation will probably be distributed, and so I just put them here, but it's really all on the certification website. And with that, I thank you all very much for your time with this, and I'm not sure if you have questions.
Lucero, there was one question in the chat regarding insurance for malpractice. Do peers have to purchase this on their own, or is this something that they obtain from their employer?
Sorry, I was on mute. There hasn't been any conversation around the requirement for malpractice insurance. I don't see a requirement in the regulation or in law that says there's malpractice insurance that's necessary.
The other question in the chat is, will the slides be posted on the website?
The slides, I think, will be posted through the conference. Yeah, they'll be posted to the conference. Any other questions from anyone? Emily, I see your hand up.
Hi, thank you. I am on the CalMHSA website right now, and I'm having a hard time getting clear on the 1,500 hours. Is that only applicable in the grandparenting process? I see that there's a deadline to register by, I think it was the end of June of this year. And I'm sorry, I'm just a little confused. I just started the peer work in June of 2022, and that was 20 hours a week. And now I'm at a full-time position for a hospital. And so I'm just trying to figure out, in order for me to become certified, I first get registered with CalMHSA, and then I have a year to complete the training requirements, which I've already done the 80-hour training requirement course. So I'm sorry, I'm just trying to get clear on all this. It's a little confusing.
Okay. Yeah, so it sounds like, so for the grandparenting process or pathway, that's where the 1,550 hours of work experience as a peer in a peer role is necessary. So that was your first question, and you'd have to be employed by on January 1st, 2022, and at the time of application, in a peer role to qualify, and then of course all the other requirements. If you've taken the 80-hour training from a CalMHSA approved training entity, you can submit your application, if you haven't done that already, for certification, so that you can then be scheduled for the exam.
Okay, so it sounds like it's a lot, I don't know if easier is the right word, but to not go this grandparenting route, the requirements aren't as
many.
Yeah. Okay.
Yeah. So some people might elect to take the 80-hour training if they have the time or want to maybe brush up on some of their skills. So they might go that route instead of the grandparenting pathway. It's definitely a choice for the individual.
Okay, so the 1,550 hours only applies to the grandparenting. For the other pathway, you do not need to have a minimum hourly requirement doing this work.
That is correct.
Okay.
Yeah, thank you, Emily. And then, so people who are interested in applying under the grandparenting process must submit their application by June 30, 2023. So a little over a month, or whatever it is, June 30th, so just a couple of months away. So make sure you keep track of that deadline.
And just one more question. I do remember hearing my mentor at my last job saying something about if you take the course, which I have already, I did that last year. It ended in like the fall. They had mentioned something about like you have 2 years from the time that has been completed to, I guess, take the test, take the exam. Is that correct?
No. 12 months. It's a 12-month approval process.
Okay.
Yeah. Approval period. Yeah.
I think that's everything. Thank you.
Okay. And then Kimberly, I see your hand up.
I don't know if you already went over it, but I was wondering, I'm sorry, can you hear me?
Yes.
Yeah, I was wondering, where do people get the access code to retake the exam?
So if a person does not pass their exam, once we get notification, so once a week we'll get notification from the proctor, so from Pearson View, right? We get those results. We will then inform the person who needs to retake that they can go to the website and then retake. If your application, if you have questions about your whomever's application, like your own application, you can call us or email us, and we will let you know the status of your application. But it does take about a week time between the time you took it. So we allow ourselves 7 to 14 days from the time you took the exam to when you're informed that you can retake it.
Okay, and then I have another question, because I work for one of the training entities. A lot of our students submit their certificates and then have like a long wait time to get their testing dates. Is that normal, or do we need to do something more on our end?
You know, that is one of the things that we're looking at right now. So we have a mechanism where if a person goes through the initial pathway under scholarship, that, you know, we let them know that their scholarship is available. They bring the scholarship to the training provider. Some people are not coming back and giving us a certificate. So that would be the first step, would be give us a certificate so we could see it. And we have a mechanism where we're immediately notified when a person uploads their certificate. And we were monitoring our queue very closely every day. So if a person has submitted their certificate and hasn't received anything in, I would say, probably like 10 days, which would even, that would probably be a lot, like a week, they should ping us and let us know. Now, sometimes people will give us the wrong certificate, and that has been a problem. So sometimes people might give us a certificate from 2 years ago that doesn't obviously meet the requirement for this particular certification. So sometimes there's that. And then we let them know, of course, we ask them to revise it to give us the correct certification. Certificate for the training.
Thank you. That was very helpful. And then I have 2 more questions. I'm sorry. Do you guys have any data on like the passing rate for the exam? Just because a lot of people ask me that too, and I'm usually like, I don't know.
Yeah, so the passing rate is something that's published annually, and that is common practice. So toward the end of the year, we'll have the passing rate. So those will be published on an annual basis. I know that's something we get every time we're out in public too. And then the other one might be the cut score, like what's the cut score, what's the passing score? And so for that one, because we have multiple forms for the exam, we don't give the cut score because it could change depending on the form. And so if I gave a number, you got a different number, you're going to say, what? You said it was this. So that's the reason why that cut score is not made available either.
Okay, thank you. And then last question, do you guys have any more study guides available, or like maybe like mock exams?
I mean, we put together a prep guide, exam prep guide, and I know there's some example questions there, but CalMHSA doesn't have a study guide per se, and we're not going to put one out.
Okay.
Yeah,
no worries. All right, those are my questions. Thank you, Lucero.
Perfect, thank you. Hi, Donna, I see your hand up.
Yes. Do you have a listing of the testing sites?
Yes, they're available on our website. Tatiana can add the link to the chat. But yes, they are available on our website.
Okay, thank you.
Welcome. All right. Anyone else? No? All right. If you do have questions, or if you do browse our website and there is no, if something's confusing or out of date or anything like that, email us, we'll correct it. If you have any questions, feel free to email us. I see a question coming in the chat.
Mm-hmm. Yes, I was wondering, for the grandfathering program, you have to have all the 20 hours completed before the July date?
Before June 30th? Yes.
Yes. So if you have everything else, but you don't have that, there's no way of extending it. That is the cutoff date?
Yes, that's correct. And that's set by the Department of Healthcare Service.
Okay, thank you so much.
Thank you.
Lucero, we do have a question from Deborah in the chat. She is asking, she's not clear on the longevity of the training. Does the training expire or go stale?
So if the question, so if the question is, will at some point training be updated? I would say that yes, I would imagine that at some point it will be updated. The training, CalMHSA approved training providers, they submitted their curriculum through, and we approved them in July. So it just hasn't been a year yet. But I would imagine that there would be or could be updates to training depending on best practice standards. And I think there was one more question, Tatiana. I thought I saw two come in. Let's see, from the completion of training, oh, I moved around. You have 1 year to get certified. Otherwise, you have to take the exam again. So when you complete the training, so your application is approved for a 12-month period of time. During that 12-month period of time, you would have completed your certification. That means you would have completed your training and exam during that 12-month period of time. And then once you're certified, your renewal is every 2 years if you're interested in renewing. What if you like, what if you would like, oh, that's from, if you would like a certificate of attending this presentation, that's from Brian at shareselfhelp.org. So if you want a certificate of participation or attendance, please email him.
Lucero, Deborah wants to know what the approval period is.
12 months. It's a 12-month period of time approval. Let me see.
She is asking what it is.
Depends on your application date. So each application is approved at different dates. So then it's 12 months from that approval of that application. And you'll see that through your email or your communication that we sent you.
Deborah, if you can hear us, the term is for 12 months for the approval period.
the chat moves around a lot. It's really hard to like, so I see there was another question that said, sorry, not exam. What would you need to pass to get certified? And you have a year to do it. You'd need to recertify by being retrained.
Okay, can I ask my question?
Yes.
I don't think you understand my question.
Yes,
I don't really
you.
understand what is meant by an approval period. Is this about the period of time from when we complete our formal training to what? I don't really understand the term. I'm sorry.
Yeah, that's okay. So when we say your application is approved for a 12-month period of time, that means that when you apply for certification and your application was approved or accepted, that's when the 12-month period of time starts, and you would need to satisfy all requirements within that period of time.
So I guess what I'm trying to understand, I went to a peer advocacy training, I completed it, and I got whatever certificate you want, whatever you call it. And then I'm told I need to do my follow-up with my hours, right? I have not submitted anything. How long do I have a certain limited amount of time before I'm allowed from completing that training from one of the training agencies to finish my hours and take the test?
No, Deborah, I think your question is similar to the one Emily had. So if you go under the grant through the grandparenting pathway, then you need the 1,550 hours of experience. But if you go through the initial pathway, you need to complete your training and then submit your certificate too. So you don't need the 1,550 hours under the initial certification, if that helps.
I'm going to look at the screen. I guess I'll call your guys' office because I'm confused. Grandfather, because I took the course like a year and a half ago. And are you talking about some grandfather like before any legislation or for any kind of? I don't understand.
Deborah, your audio is very choppy. Send us an email and then we'll look at your individual kind of application and go from there. And any other questions?
One more question. Are there still scholarships available?
Yes, there are still scholarships available. So if you are interested, please register on the certification website and apply, submit your application, and also, of course, submit your application for scholarship.
So if I miss the deadline for the grandfathering in, then I have to go back the 80-hour program.
Yeah, so if on July 1st or whatever, July 3rd, you wanted to, yes, because the parenting pathway closes after June 30th.
So then I would have to go back in and do the 80-hour course.
Correct.
Thank you.
And then Brian is saying all presentations are being recorded and will be made available next week. Visit the shareselfhelp.org/conferences.
Is there someplace on your website that explains that deadline? Because I have a WhatsApp chat of grads from a group that I was in, and I'd like to send them the info so they understand this. So like a flyer that I could post or something?
No, I don't think we have it in a flyer. It's definitely on our website.
Can you make it? So we can disperse the information. People need to know that there's a deadline.
I think we have it definitely on our first page. It's right on the first page.
Okay, that's fine. Just a link to the home page is good. Okay.
Yeah, I think Tatiana put that on there, but we'll put it back.
Who regulates curriculum? You guys oversee who gets to be a training facility, but do you decide what the curriculum is too?
Yes. Well, we decide on so the state decided on the core competencies, like the 17 core competencies for peer specialists. And then we confirmed or defined those core competencies, and then we approved training providers that met that requirement. So the style of teaching, of course, is different for each training provider agency. But in terms of
Because I just like to
covered, it's there.
interject, the training I got was mostly knowledge-based, you know, the history, the laws involved, HIPAA, but there wasn't any actual skills taught. Is that considered something that should be covered, a skill, for example, let's say communication skills? That's something I brought up in the union meeting.
Yeah, so the core competence, I mean, I don't know all of the details this minute about the core competencies, but yeah, you're just definitely learning some skills as well.
So that's not covered in the exam, right? The exam is only concerned about knowledge base.
It looks at people's knowledge, skills, and abilities for the exam. I was missing a lot. Is that it, Tatiana?
Yes, there are no other questions in the chat.
All right. Well, with that, I thank you guys very much. It's almost 3 o'clock. So thank you very much for attending. Thank you, Cher, for inviting us. Visit our website, email us if we were unclear or if you have additional questions. Thank you all very much and good luck and have fun at the rest of the conference.
Thank you.
Thank you, guys.
Bye, everyone. Thank you.